Finish it up now. I just want to do it kind of systematically. So we've already talked about page 88. We've already talked about the iliac crests, the ASIS, greater trochanter, the inguinal ligament, the pubic symphysis, and the femoral triangle. We got all that. This is from your book. This image is from your book, from the A and K section. It's really, really nice because you want to refer to some of these. So when we think about these muscles on page 89 that we're going to try and palpate now, tensor fascia latae, right here. We're going to move our hands down and move along the IT band. Okay? Rectus femoris. Anterior thigh, getting up into the AIIS. Next is quadriceps. They mention here, note tenderness and atrophy. They say VMO in parentheses. VMO, and I point this out to some of you on that cadaver. VMO can sometimes be a problem because of the way it's angled. It has a nice pull on the patella, and it kind of offsets the pull of the IT band in the kneecap sometimes. So you want to look here and see if this is atrophied and just palpate a bit. Next is the adductor muscle group. So now we're going to work our way up medially, right? And then we're going to stop. That's our anterior palpation completed. Okay, so let's go through those. Then PSIS, like I said, we're going to start with that, but that's not posterior. So if I'm going to go anterior, everything on page 88 I've already done. Page 89, TFL. What am I looking for? Looking for the iliac crests. Okay, so iliac crests, ASIS, I'm going to start right here. So that's his TFL, right? Iliac crests, ASIS, I'm just going to come down laterally off that area. That's muscle. What's next? I want to go to IT band. So now I'm going to work my way down a little bit. And you can feel just a little bit of a change in the quality of that tissue right there. Okay, so here's muscle. As I work my way down, as you guys saw in the cadaver, that turns into IT band. I'm taking my way all the way down. And you can kind of feel it, right? A little ropey if you get toward the ends of the beginning, and some of you said that even in the cadaver lab. You know, you can feel it on yourself. And as you come down, we're just palpating down. Am I palpating over more than just the IT band? Yes. I am. I'm on the IT band, but I'm also into subcutaneous tissue as well. There. Okay, so there's IT band, right? And really gets tight on him right down through here. And you can feel that. Feel that tissue right there? That's IT band, all right? Working my way up and down. Okay? IT band, tensor fascia latae. Rectus femoris. Okay, so I could ask him to give me a nice contraction. Okay, so I can see the VMO, I can see the vastus lateralis, and right up in between those two, let him go ahead and relax, is rectus femoris. Okay, so I'm going to work my way up rectus femoris at that point. All right, work my way up, ASIS, AIIS, right there, that's where the attachment point is. Be careful, these are tender areas, okay, but that's the insertion point right there, the origin of rectus femoris, and you're going to palpate both sides. All right, looking for tenderness. Next is the quadriceps, where I talked about that. Palpate the VMO, and then palpate the vastus lateralis out here. And those are on your picture there. That's in the A and K section of your book. And then finally, in this position, the adductor muscle group. Okay, I'm going to start down low. Let the patient know why I'm palpating here and work my way up. Okay, and then work my way back down. There's the adductors. So I've palpated laterally, right? I've palpated anteriorly, and now I'm palpating medially. So I've completed all my palpation in this position. Once again, just to review, if I want to get on that femoral triangle, okay, so I'm going to get here, pubic symphysis, there's my inguinal ligament right there, just come down from that femoral pulse. Okay, so don't forget that. Write that down because that's not in your book how to find that. Questions on any of that? Let's go ahead and give this a shot, and then we'll come back and do posterior. Finish that up, that palp.